Hi, welcome. You're watching the CATA Alliance Mobile Health channel. I'm David Farnes, Executive in Residence with the CATA Alliance. Joining me today is Andrew Wilcox. He's president of EverAge Consulting out of Halifax. And he's an inventor, a developer of iCare Adventure, a solution he developed in partnership with IWK Hospital in the Maritimes. And this is a great solution, a great application that will help children deal with their anxiety while waiting in an emergency room at a hospital. So Andrew, welcome.
Thank
You
you.
for joining us. So why don't we kick off? Why don't you tell us a little bit about iCare Adventure and how it came to be?
Well, sure, David. As you indicated, it's an application that's run off of iPads and given to children when they enter the emergency at the IWK hospital. The intention is to improve the overall experience of not only the patients but the parents as well when they have to visit the emergency. As you might know, or any of the listeners who have children might know, that sometimes you have to wait, and that waiting, particularly if your child is has some anxiety or fear or pain, can not be a really great experience. And sometimes by the time the patient finally gets to see a doctor, they're in such a state that the doctor can't really effectively treat them. So the application is first and foremost a means of improving that overall experience, so that when they finally do get to see the physician, they're in a much better frame of mind than they would be otherwise. But it's more than just that. It's more than just a distraction for the children. It's also a therapeutic tool. So we actually have implemented a number of therapeutic pathways that the patient, along with their parent, can initiate while they're waiting in the waiting room. So, for example, if you indicate that you're suffering from asthma, then we'll initiate an asthma protocol where they can start taking Ventolin ahead of time. So hopefully, when they get to see the physician, they've had several doses of Ventolin. They should be feeling much better, and then hopefully a quick rubber stamp from the physician, and off they go. Same applies for any type of pain, concussions, vomiting. All those are therapeutic pathways that are integrated into the application and sort of go hand in hand with the overall gamification of the patient care. Beyond being a therapeutic tool, it's also an educational tool. We reframe many of the conditions that the patients might be facing when they come into the hospital. So as an example, if a child comes in and they've got a sprain or maybe possibly a broken bone, we try to reframe that situation for the kids to say that, don't be so worried about your broken bone. Did you know that your broken bone's going to be stronger than it was before it was broken, after it's healed? Or, if you've got a cut and you're going to need stitches, we say, your body is so amazing that it has this ability to sort of pull itself together and heal itself. So kids can start sort of looking at a positive aspect of what might be sort of facing them, and then hopefully be sort of less anxious about it. But David, the last thing, which is kind of an interesting point, is iCare Adventure is a research platform. So not only are we able to aggregate data from all the patients in, say, the IWK, we can actually do this across multiple facilities all over North America and simultaneously do real-time data aggregation and reporting. And this includes not only elements that the children may have entered into the iPad, but also timing-related activities, such as the amount of time that they spent in the waiting room, the amount of time that they spent in an examination room, the amount of time a physician actually spent engaging with them, etc. And all that can be available in real time, sort of across the country.
And so what has the reaction been by patients, maybe the families, the parents, the kids themselves, and the clinicians at IWK?
Well, the reaction has been very, very positive. We've had our initial round of research. The research that we gathered shows that the tool really has a dramatic impact We are measuring satisfaction across patients and parents, and there was a significant increase in satisfaction. We're also able to record a significant increase in pain management, as well as a reduction in the overall number of blood work tests ordered by the physician. So across the board, whether it be the patient, the parent, or the physicians, we're seeing a very wonderful response, and everybody's pretty excited about what's going on at the IWK.
And of course, you work closely with staff at IWK. I mean, how did that partnership evolve? How did that work for you?
Well, it was an interesting story. There's two sort of friends of mine that have been sort of actively involved with the IWK, and they set up an initial meeting between myself and Dr. Brett Taylor, whom I've got a replica right behind me. And, it was something simple as a couple beers and French fries downtown, where we talked about different ideas and where the need was. And within that sort of initial meeting, the idea, the essence of iCare Adventure was formed. And it's been a bit of an adventure since then. We've been working what is probably about 4 years now on the overall solution. It's been implemented at the IWK for just over a year. Now we're working on our second iteration of that application right now. But the overall partnership with the IWK has been really wonderful. Brett, a key individual, but there's been others at the hospital as well. Child life specialist, Buddington the Clown was a very active participant. Many of the nurses were involved as well. So lots of input and lots of sort of energy behind the overall project from the IWK staff.
So where do you go next with iCare Adventure?
Well, as I indicated, we're working on our version 2 right now. Version 2 takes some of the learnings from our initial research and has made some modifications. It's also a, um, a maturing of the overall application, so that we have far greater flexibility in making configuration changes to the application. Uh, the app, as you might know, natively built applications, the modification cycle of those could be long, but we've actually built iCare Adventure so that it could be remotely configured by a server in real time. And that provides a lot of flexibilities for the hospitals to make adjustments to protocols or to messaging, and even sort of upload new videos, add in multilingual capabilities and things like that. We're looking at getting that implemented in the IWK at the end of this month, and we'll be running our second round of research over the winter months.
Awesome, sounds really good.
Great.
So one thing we like to explore with innovators is, what challenges have you run into? What enablers, what tools are out there that have helped you? So why don't we start with the positive first? Give us an example of something that worked really well, something you were able to leverage.
Well, I have to say, one of the things that has worked the best has been our relationship with some of the individuals at the IWK. Dr. Brett Taylor, huge supporter of what we're doing, and has been able to add an enormous amount of value, bring sort of that experience that we need to build something that's going to be truly effectual for the children. Beyond that, we have been using some new open source tools. We're using things like MongoDB, which is, as you know, a new and upcoming repository that's really designed for big data and loosely structured content, I should say. Or also some other open source platforms like Node.js and Keystone.js as well, to form sort of that server infrastructure. And that has enabled us to really accelerate that server development aspect of the overall application that is used to control or remotely configure the application.
Very interesting. And so what were some of the challenges? Maybe highlight one challenge you ran into in implementing this.
Sure. The biggest challenge by far was the access to funds for the IWK to purchase the iPads and the hardware that were required for the application. And because this at that point in time, it was not a proven solution. And as such, it was difficult to find funds to get that hardware. And we were actually stuck for about a year and a half, looking for different revenue sources to go out and be able to buy a bunch of iPads and server and things like that. But eventually, we managed to come up with those funds and move forward fairly quickly after that. So, that was this kind of an interesting situation to be in, because it was really testing the possibility of a solution, as opposed to having solution which was justified by research, which we have now. But at that point in time, it was really difficult to try and make a case for what we wanted to do.
So you mentioned a couple of things, the collaboration and the importance of the collaboration between, I'll say, an industry partner like yourself and an institution like a hospital, or more stronger relationship with clinicians within a hospital. You mentioned the challenges that that institutions have in finding funds to implement these innovations and trial and improve them. And you've mentioned, not directly in response to that question, but you mentioned throughout the presentation, research. So who are your research partners? Do they fit in? Are they at IWK? Are they on your team? Or are they another group?
No, they're with the IWK. I think it's important that IWK or any sort of medical institution be the ones that manage that research, that myself as a developers are really at arm's length from that research. So it wouldn't be really as credible if I were participating sort of in the research. Now, I understood what the goals of the research were to prove, and obviously we were developing a platform which would positively impact those results. But it was the IWK, and in particular, Dr. Taylor. Now, we've already had two other sort of smaller mini research projects, which are actually being led by two research assistants right now. We're doing one sort of mini research project to validate our pain scale, and a second to determine whether or not patients and parents have the ability to self-diagnose what it is that they're there for, and what content or protocols would be most effective for their children. That research going on right now. We'll be following that up with sort of our next major phase of research, which would be the validation of the version 2.0 that we've come up with.
Awesome. So my final question to you today, Andrew, is for the benefit of the community that's out there. Many people working in the mobile health space, trying to develop different applications. Do you have one piece of advice you would share with innovators out there?
Well, I would say that the key, well, I have two, actually. The first is that when you're setting off to develop something new, first and foremost is go to the source and find out where the need is, or what the need is, and work there. Really, as a technologist, I have no idea what, the needs of the hospital are. So go to the source and find out from them, and you're more likely to land on something, and try a couple different potential areas where you might be able to provide a solution, and sort of pick one and go with it. The second is that whatever it is that you're developing for healthcare, it needs to be backed up by research. If you don't have research to back up the value potential to the patients, or to the hospital, then you're really going to have a really hard time selling that into other institutions. They're going to want to know that it is validated and in a proper way. So I would definitely look at both of those particular elements and ensure that you start off with a project that has a definitive need that's stated so by the institution themselves, and secondly, you really back it up with some valid research to show that there's a real value to the institution.
Very good pieces of advice, Andrew. Thank you very much for sharing those with the audience and sharing your story with the audience. We will post links to iCare Adventure, as well as links to get a hold of Andrew if you want to, anybody in the audience would like to follow up. So Andrew, thank you again for joining us today.
My pleasure. Thanks for asking me.
So this is David Farnes with the Canadian Advanced Technology Alliance signing off. You've been watching CATA's Mobile Health channel. Thank you.